Imagine waking up, looking in the mirror, and noticing your skin has taken on a yellowish hue. It might seem like a minor change, maybe just from stress or lack of sleep. But for many, this unexpected yellowing can be one of the first signs of a serious underlying issue, pancreatic cancer. Jaundice, the yellowing of the skin and eyes, is often one of the earliest clues that something could be wrong. This symptom isn't just a superficial change, it's a warning sign from deep within the body. Pancreatic cancer is tricky. By the time many people realize they have it, the cancer has often already spread. The purpose of this lecture is to help you understand why jaundice happens, why it's linked to pancreatic cancer, and what it means for those affected. We'll break it down simply, diving into the science behind jaundice, how pancreatic cancer causes it, and what to look out for with other symptoms. Understanding jaundice, the yellowing effect. Jaundice isn't a condition by itself but a sign that something is off in the body. It happens because of a buildup of a substance called bilirubin. Now, what's bilirubin? Picture it as a yellowish-brown pigment produced when your body breaks down old red blood cells. Normally, the liver processes bilirubin, packaging it into bile, which travels through the bile duct into the small intestine and finally exits your body. But here's where it gets interesting: if something obstructs the bile duct, bilirubin doesn't make it to the intestines. Instead, it builds up in the body, turning the skin and the whites of the eyes yellow. Pancreatic cancer, particularly when it's located in the head of the pancreas near the bile duct, is a major culprit in causing these blockages. Why pancreatic cancer and jaundice are connected. Not all cases of jaundice mean cancer, but it's a very common symptom of pancreatic cancer. Why? Well, let's explore a bit about the pancreas itself. The pancreas is located right next to the bile duct. When a cancerous tumor grows in the head of the pancreas, it can press on the duct, narrowing it. This pressure stops bile from flowing properly, causing bilirubin to build up, and that's when jaundice appears. So, if someone notices yellowing of their skin or eyes, it's crucial to understand that their pancreas might be involved. A cancer in the body or tail of the pancreas, on the other hand, may not lead to jaundice until a later stage. In these cases, the tumor needs to spread enough to reach the bile duct. This is why, in pancreatic cancer, jaundice can show up at any stage, depending on the location and spread of the tumor. Other telltale signs of pancreatic cancer. Jaundice may be the first symptom, but it's rarely the only one. Here are other symptoms to watch for. 1. Unintended weight loss. Many people with pancreatic cancer start losing weight without trying. This is often due to a loss of appetite, which can be one of the first signs that something is wrong. 2. Abdominal or back pain. This pain can become severe as the cancer grows and presses on nearby organs or nerves. While back pain can have many causes, persistent pain that doesn't go away might need a closer look. 3. Nausea and vomiting. A tumor near the stomach can make it difficult for food to pass through, causing nausea or vomiting. 4. Blood clots. Sometimes, the first sign of pancreatic cancer is a blood clot, especially in the leg. This can lead to pain, swelling, and redness. If the clot travels to the lungs, it can become life-threatening. 5. Diabetes. Although rare, pancreatic cancer can interfere with insulin production, causing blood sugar levels to change. This could even lead to a diagnosis of diabetes in someone who has never had issues with blood sugar before. 6. Liver or gallbladder enlargement. A blocked bile duct can cause bile to back up, enlarging the gallbladder. If the cancer spreads to the liver, it too can become enlarged, leading to discomfort and visible swelling. Managing jaundice in pancreatic cancer. Let's dive into solutions. How do doctors manage jaundice caused by pancreatic cancer? One option is to use a stent, a small, narrow tube, to keep the bile duct open. This can relieve the blockage and help bile flow again, reducing jaundice. If a stent isn't suitable, pancreatic biliary bypass surgery is another option. In this procedure, the bile duct is cut above the blockage and reattached to the intestine, bypassing the cancerous area. While this isn't a cure for the cancer, it can greatly relieve jaundice and improve quality of life. In cases where neither of these procedures is possible, symptoms like itchy skin can be managed with antihistamines. Cooling the skin, keeping it moist, and using medications like diphenhydramine, found in brands like Benadryl, can help reduce discomfort. Survival rates, what can you expect? Pancreatic cancer has one of the lowest survival rates, but early detection can make a difference. On average, only about 13% of people with pancreatic cancer are still alive 5 years after diagnosis. This isn't to say there is no hope. If caught early, treatment can be more effective, and survival rates improve. When doctors look at survival statistics, they often refer to the 5-year relative survival rate. This means they're comparing people with pancreatic cancer to those without it, measuring how many are still alive 5 years after diagnosis. It's crucial to remember that these rates are generalizations. Every individual case is unique. Frequently asked questions. Is jaundice a sign that pancreatic cancer is in its last stage? Jaundice can show up at any stage of pancreatic cancer. When the tumor is in the head of the pancreas, jaundice may appear early on. Tumors in other areas, like the body or tail of the pancreas, might not cause jaundice until later. What are common symptoms of advanced pancreatic cancer? In the later stages, symptoms are often more pronounced. People may experience severe weight loss, intense pain, a loss of appetite, and weakness. By this time, the cancer may have spread to other organs, leading to additional symptoms. Final thoughts. Pancreatic cancer is a challenging diagnosis, but understanding symptoms like jaundice can help detect it earlier. Yellowing of the skin and eyes, abdominal pain, weight loss, and other symptoms can be important signals that shouldn't be ignored. Early diagnosis may improve treatment options and the overall outlook for those affected. So, if you or a loved one starts noticing any of these symptoms, especially yellowing of the skin or eyes, take action. It might seem like a small thing, but it could be an important clue that leads to a critical diagnosis. Knowledge and awareness are powerful tools in the fight against cancer, and by understanding the signs, you're already taking an important first step.